So the first type of therapy, the first type of psychotherapy that we talk about in chapter 14 is psychoanalytic therapy or psychoanalysis. So when we think about psychoanalysis, we kind of think of this type of a scene, the person sitting behind, taking notes, a person laying on the couch, and even the caption is fitting. Your mother never read to you and your father never hugged you. That's why you drink from the toilet. So I'm sure that you've seen a lot of other cartoons like this, cartoons depicting what people envision when they think of psychoanalytic therapy or psychoanalysis. The stereotype is the person laying on the couch and talking while some bearded gentleman sits behind and just passively listens. Well, this stereotype is actually not that far from the truth. It's pretty accurate. This stereotype shows some of those key ingredients of traditional psychoanalysis. So, psychoanalysis is a type of psychotherapy originated by Sigmund Freud, in which free association and transference are used to explore repressed or unconscious impulses, anxieties, and internal conflicts. So, as you may recall from our discussion about personality, Freud stressed the early childhood experiences provided the foundation for later personality development. When early experiences resulted in unresolved conflicts and frustrated urges, these emotionally charged memories are repressed or pushed out of the conscious awareness. Although unconscious, these repressed conflicts continue to influence a person's thoughts and behaviors, including the dynamics of his or her relationship with others. So, psychoanalysis is designed to help unearth those unconscious conflicts so that the patient can obtain insights into the real source of his or her problems. Through the intense relationship that develops between the psychoanalyst and the patient, long-standing psychological conflicts are recognized and re-experienced. Now, if the analytic treatment is successful, then the conflicts are resolved. Freud developed several techniques to coax those long repressed memories, impulses, and conflicts out of that unconscious and into the patient's consciousness. So the first of these is free association. And in free association, the patient spontaneously reports all of his or her thoughts, mental images, and feelings while laying on a couch. Now, sometimes the person may give them some type of a word to begin their free association with, but then everything else, that flow of consciousness, all comes from that person's thoughts. The psychoanalyst usually sits out of view, occasionally asking questions to encourage that flow of associations. So that's why you typically see them sitting behind the person laying on the couch. They're out of sight, they're out of view, and yes, they do take a lot of notes. Now, when there are blocks in free association, such as a sudden silence or some kind of an abrupt change in topic, those were thought to be signs of resistance. Resistance is the patient's conscious or unconscious attempts to block the process of revealing repressed memories or conflicts. Resistance is a sign that the patient is uncomfortably close to getting through to whatever that is that has caused that person problems in their present. They're getting very close to uncovering that thing from their past that's impacting their now. Now, the psychoanalyst sometimes makes carefully timed interpretations or explanations of unconscious meanings of the patient's behavior, thoughts, feelings, or dreams. Now, the timing of these interpretations is very important. If the interpretation is offered before the patient is psychologically ready to confront an issue, then he or she may actually reject that interpretation or respond defensively and increase that resistance. One of the most important processes that occurs in the relationship between the patient and the psychoanalyst is called transference. Transference occurs when the patient unconsciously responds to the therapist as though the therapist were a significant person in the patient's life, typically a parent. So in psychoanalysis, transference is important and necessary. In other forms of therapy, if transference occurs and they start blaming the therapist for things, that's typically a problem and something that has to be resolved. It is something that is sought after in psychoanalysis. In fact, the psychoanalyst encourages transference. For example, they might purposely remain silent. They'll remain as neutral as possible. They say as little as possible, just in order to get that transference to occur. Now, the psychoanalyst does not reveal any personal feelings, doesn't take sides, make any judgments, and doesn't actively advise the patient in any way, shape, or form. Neutrality is designed to produce what they consider to be optimal frustration. That way, the patient will transfer and project any unresolved conflicts onto that psychoanalyst. These conflicts then get relived and played out in the context of relationship between the psychoanalyst and the patient. So whatever that conflict is, they relive it out, that conflict from the past that was hidden in the unconscious. So the psychoanalyst wants the patient to discover something, some problem that he or she had with perhaps a parent or someone from his or her past, and then have that exact same conflict with that psychoanalyst, and then relive all of it and work through it all in the present moment. So these techniques are designed to help the patient see how these past conflicts influence his or her current behaviors and relationships, including his or her relationship with that psychoanalyst. Once these kind of insights are achieved, the psychoanalyst helps the patient to work through and resolve these long-standing conflicts. As these resolutions occur, maladaptive behavior patterns that were previously driven by this unconscious conflict can be replaced with more adaptive emotional behavioral responses. The intensive relationship between the patient and the psychoanalyst takes a lot of time to develop. This doesn't happen overnight. The traditional psychoanalyst sees the patient 3 times a week or more, often for years. Traditional psychoanalysis is very slow and expensive, and very few people can actually afford to receive this type of therapy. So there's also short-term dynamic therapies. Most people today don't enter psychotherapy seeking the kind of major personality overhaul that traditional psychoanalysis is designed to produce. Instead, people come into therapy expecting help with some specific problem. People also expect therapy to provide beneficial changes in a matter of weeks or months, not years. Many different forms of short-term dynamic therapies based on traditional psychoanalytic notions are now available. These short-term dynamic therapies have several features in common. Therapeutic contact lasts for no more than a few months. The patient's problems are quickly assessed at the beginning of therapy, and then the therapist and patient agree on specific, concrete, and attainable goals. In the actual sessions, most psychodynamic therapists are more directive than in the traditional psychodynamic analysis. They actively engage the patient in dialogue. They may ask the patient questions. It's more than just sitting behind them and taking notes. There's an engagement. There's a level of, maybe, so how did that make you feel? So what do you think about that? Have you tried this? All of these things can occur in the short-term dynamic therapy. Now, as in traditional psychoanalysis, the therapist uses interpretations to help the patient recognize hidden feelings and transference that may be occurring in important relationships in his or her life. One of the key things to remember is that this is considered to be short term. It is, we have this goal, we work toward it. Once it is done, therapy is done. One form of short-term psychodynamic therapy is interpersonal therapy, and it's abbreviated IPT. Interpersonal therapy focuses on current relationships and social interactions, not on past. So in psychoanalysis, they're looking at what happened in your past, what happened with your relationship with your mother, your father, or some caregiver that's causing this now. IPT looks at what's happening in your relationships currently. It was originally developed as a brief treatment for major depressive disorder, and it's based on the assumption that psychological symptoms are caused and maintained by interpersonal problems. The therapist helps the person to understand that his or her particular interpersonal problems, what they are, and how to resolve them. Now, this therapy can be long or brief, but it's very highly structured. It's currently used to treat things like eating disorders, substance use disorders, as well as major depressive disorder. It can also be effective in helping people deal with interpersonal problems like marriage conflict, parenting issues, conflicts at work, anything where your relationship with another person is having issues. Now, of course, contemporary research has challenged a lot of Freud's original ideas, as we've talked about repeatedly. We've talked about how, he looks at one of his classic themes was always blaming the mother, and it was always sexually driven. And so there's a lot of challenges to all of this currently. It's important to know, however, that modern research continues to study the specific factors that seem to influence the effectiveness of basic Freudian techniques, such as interpretation, transference, and the role of insight in reducing psychological symptoms. It's important to know that the cost and duration of psychoanalysis is often a factor in people actually using psychoanalysis as their choice of psychotherapy.